Number one, calcium and phosphorus homeostasis. Vitamin D maintains the calcium and phosphorus level in the blood. They're critical for the bone mineralization and growth. It enhances the absorption of calcium from intestine and helps the kidney to reabsorb calcium, ensuring the proper bone formation and strength. So you have seen that on the one hand, it absorbs from the intestine, and secondly, it prevents excretion in the kidney, so it reabsorbs the calcium and try to maintain the serum calcium level and give the strength to the bone. Prevention of the rickets and osteomalacia. Vitamin D deficiency can lead to the rickets and osteomalacia, resulting in the bone pain and muscle weakness due to the inadequate bone mineralization. This is the crunch slide to understand the calcium metabolism. That this is parathyroid hormone which secrete. There are receptors, calcium sensitive receptors. If the serum calcium level is low, they get stimulated, and it affect on the kidney, increase the synthesis of the 125 hydroxy cholecalciferol, or we can vitamin D. So the serum calcium level is maintained. Similarly, it also affect on the intestine and increase the reabsorption of the calcium. And on the negative feedback, which is if the calcium is low, that's why we get the osteoporosis, that it mobilize the calcium from the bones, resulting in the decreased strength of the bone, causing the osteoporosis. Second, immune system modulation. Number one, innate immune system activation. It enhances the first line of defense, the innate immune system, by promoting the activity of the phages and dendritic cells responsible for the identifying and destroying the pathogens. Whereas second is adaptive immune system through the T cell and B cells, provides a more specific and long-term immune response, promotes the development of the regulatory T cells, which is also known as trigs, suppress the excessive immune response, and prevent the autoimmunity. Can suppress the production of the autoantibodies by B cells, which helps to reduce the risk of the autoimmune disease. So you have seen on the one hand, in the first step, it increases our defense system, and secondly, it suppresses the opponent which are attacking our body. That's auto-regulatory system. It prevents the autoantibodies. So by balance of these two, it helps in the modulation of the immune system. If you see this slide, macrophage and dendritic cells is the innate immunity, while the other trigs and these cells are the adaptive immune system. Number three, reduction of the inflammation. Reduction of pro-inflammatory cytokines, the interleukin 6, interleukin 1, and tumor necrosis factors are involved in promoting the inflammation. So these are reduced. So these are involved in the production of the inflammation. So reduction of these cells will prevent the inflammation. Second, increase in the production of the anti-inflammatory cytokines. Interleukin 10 helps to preventing the chronic inflammation. And number three is a decrease C-reactive proteins. There is evidence that it decreases the level of CRP. So now we have seen, as in the previous slide, we have seen this balance in the immune system. Similarly, here in the inflammation, the first step is that those which are responsible for the inflammation are reduced, and second, there is a increase of the anti-inflammatory cytokines and decrease CRP. So this balance helps in controlling the excessive immune response and preventing the chronic inflammation.